Hello, everyone. My name is Greg Kirk. I'm a health coach, Lyme disease advocate, and Reiki energy practitioner. And I've been kindly invited by Dr. Mariah Hinchy to speak about Reiki and other energy healing modalities as an adjunct therapy to Lyme disease treatment. I want to welcome all members and participants in the Lyme Bites Symposium, as well as anybody else, Lyme patients and so forth, who might be seeing this elsewhere. Before we get started, just want to talk a little bit about myself, explain who I am. In 1997, I was trained in a modality or a technique of Reiki known as Usui Reiki. And a few years later, I became a full-fledged Reiki master. In 2005, I was diagnosed with Lyme disease. And after being 2 years misdiagnosed, going through 2 years of testing. In 2011, I was able to reach remission using a combination of herbal remedies and strong energy healing techniques that I'll go into later. The year after that, in 2012, I created the Ticked Off Music Fest, which is the country's only ongoing Lyme disease benefit concert series. In 2015, I founded the Ticked Off Foundation, which is a Lyme disease patient treatment support group, a nonprofit. In 2017, I collaborated and created and launched LymeKnowledge.com website, which is a free information website about Lyme disease, bringing information from authors and other well-known people in the Lyme disease community, as well as patients. And we update that information through blogs. Also in 2017, I opened the Lyme Recovery Clinic in Darien, Connecticut, to help patients with all natural treatments, herbal supplements, intoxicative detox measures, energy healing, health coaching, and counseling practices. And in 2018, I wrote and published my book, The Gratitude Curve, Using the Lessons of Chronic Illness to Reach Personal Empowerment. So the question you might be having, especially if you're at the Lyme Bites Symposium, what's a guy doing talking about Reiki healing at a Lyme disease conference where we're mostly talking about treatments and medicine and so forth? Well, the idea is to raise awareness of Reiki and other energy healing modalities as a possible adjunct to chronic Lyme treatment, especially for patients who have been stuck or have reached treatment success plateaus. The idea is not to introduce it as a substitute for physical treatments, but it works really well in tandem with the physical treatments, as also things like mental retraining and so forth. The other point is to educate about how the modality works and its best uses. Also to underline the importance of the combination of physical, mental, and energetic treatments, and using the mind-body-spirit connection as a pathway to remission, to kind of take all of the focus off of just physical treatments and medicine. Not that it's not important, but sometimes that's the only focus, and that's where a lot of patients and even practitioners get stuck there and get forced into other areas of things like neural retraining, monitoring and helping a patient with their thoughts, trauma release, things like that. And then, of course, you get into energy healing. The final point here that I would like to bring about is to provide some case studies from my practice showing the successes and even some of the failures, and kind of dissecting where things went right and where things went wrong. So pulling all the way back, what is Reiki and energy healing? Reiki is a Japanese form of energy healing, a type of alternative medicine. And it's practitioners use a technique called palm healing or hands-on healing, through which a universal energy is said to be transferred through the palms of the practitioner to the patient in order to encourage emotional and physical healing. As most true Reiki and energy healing practitioners will tell you, they're not doing magical powers on the patient. Basically, what they're doing is they're opening up the possibilities for healing, and it's the patient's own body and energy that does the actual healing. Macau Usui taught his system of Reiki in Japan to more than 2,000 people during his lifetime in 1926. And the first Reiki clinic in the United States began in 1970. Today, there are hundreds of offshoots of the original Usui Reiki technique, and some of these modalities incorporate remote or distance Reiki, where the practitioner and the patients are not in the same physical location. I employ both in-person and remote Reiki healing. Energy healing is the term most practitioners use to describe the more general practice of using universal energy to help a patient heal. So Reiki and all of its different forms are just one of the modalities included in this group that also comprise theta healing, reconnective healing, some forms of Qigong, healing touch, pranic healing, shamanic healing, restorative touch, just to name a few. So what happens during a Reiki or energy session? As I mentioned, there's the in-person session, and then there's the remote session. So during an in-person session, a practitioner will use their hands to gently move universal energy over a patient's body, usually concentrating around the 7 chakra areas, the body's natural energy centers. Not all practitioners use their hands, and some also employ other modalities from craniosacral reflexology to shiatsu. During the remote sessions, a patient and the practitioner can be miles away from each other, and the practitioner will focus on the patient's energy body and facilitate the removal of any blocks to healing that are evident. If a patient is experiencing long-term plateaus in physical treatments and is looking to break that cycle, an energy healing modality might be the most effective way to achieve improvement. And energy treatments are particularly good at relieving emotional, energetic, and spiritual stress, as well as trauma energy. The typical patient tends to experience grogginess and sleepiness after a session, at least during the sessions that I employ. Taking a nap or resting can help the energetic changes integrate in the best way. I usually tell patients after a session with me, just imagine that you'd had a procedure done in a doctor's office. So that, after that, you wouldn't go out bowling, or you wouldn't go to the shopping or something. So you go home, you take a nap, and you treat your body in the same way. So over the next 18 to 24 hours are when the majority of the benefits can be felt, but I've had patients report positive benefits several days afterwards. So just here's a little bit about my story. Sometimes it's important in a patient's healing to rule out some treatments by experiencing them and having them fail. That was my early experience during chronic Lyme healing. Even though I had been trained as a Reiki practitioner in 1997, when I finally was diagnosed with Lyme disease in 2005, Reiki was the last thing from my mind, because my allopathic doctors had convinced me that Western medicine was the strongest and most effective means to treat chronic Lyme, and they advised me to stay on antibiotic treatment, quote unquote, until I felt better. I went through 3 PICC lines, several rounds of painful intramuscular bicillin injections, multiple simultaneous oral antibiotics, opioid treatments for pain, and an Adderall prescription when I complained to my doctor of fatigue. This combination, over the course of 6 years, as you can imagine, brought my immune system to a halt, and ultimately the rest of my body began to shut down. And there didn't seem to be any alternatives offered by my doctors. So I was more or less shoved into alternative options, and to the point where I actually reached out to a psychic to consult on my healing. So at that point, I felt forced into these other treatment protocols that involved the alternative and herbal treatments my doctors warned me about. To my surprise, when I employed them, they proved to be much more effective, and my healing outcomes went from a downward spiral to an upward one. And I just want to say one thing, mind you, if seeking medical advice from a psychic sounds pretty desperate, then you're getting the proper picture of how badly the typical Lyme patient is served by the traditional medical community, healthcare system, and insurance companies in this country. Never in my wildest dreams would I have considered something like that just a few years prior, but there I was. So the psychic recommended a couple of different healers. The one that was most profound was one I had to fly to Brazil to experience. You can see in the photographs to the right my before and after shots. This is healer never touched me. I was in this healing center. I stayed there for 2 weeks, and physically, you can see physically I changed. The photograph at the top, I have so much inflammation. My face is asymmetrical. And then 12 days later, all that inflammation is gone. All of my symptoms went away. But I found that when I flew back home and rejoined the lifestyle that had contributed to and caused many of my symptoms, I needed physical treatments to help stay in remission. By lifestyle changes, changing stress levels in my life, changing my diet, all of that helped me stay in remission. The other thing I noticed is that as I came back and told my story about my healing, which I wrote about in my book, The Gratitude Curve, I just told people what I went through, and I recommended that they go down and do the same thing. So a couple of people did do that. And one woman came back and said, Greg, I did everything you did. I did everything you said, but I came back, I didn't have the same experience as you. And basically she said, because I'm not you. And that that was a real eye-opener and a lesson to me that, don't compare your healing to others. You are not them. And removing expectations from healing is important. So I had no expectations when I went to this place. And I think that's one of the major contributing factors to why I got better. I didn't get in the way of it. Thoughts can really influence healing effects, either positive or negatively. So removing expectations is a good thing. Monitoring, your symptoms and your outcomes every step of the way during a treatment can really slow things down. And it again causes mental interference. So what is your role in healing? Full participation is needed, but staying out of the way mentally and letting the treatment work is the best advice I can give. So let's talk about a couple of case studies here. Here's the first one. One of the first cases I handled about 10 years ago for Lyme disease was a 32-year-old Caucasian female. She had tested positive for Lyme 3 years prior and had tried antibiotics and herbal treatments during that time. Prior to the illness, she was a distance runner and very active in hiking and cycling. When she contacted me for help, she had stopped all physical activity and was forced to stop working. Her main symptoms were deep joint pain in her legs and shoulders, daily fatigue, malaise, and other traveling symptoms, including headaches, sporadic pain in various body parts, etc. So we did a remote session because she's all the way on the other side of the country. And the session lasted about an hour. And we did it over the phone where I basically talked to her and I focused on her energy body. And through mental thought, I helped facilitate the removal of certain blocks on her energy body. She felt it. And after the session, she was very sleepy. So she slept for 2 hours. She reported immediately thereafter. And after waking, she reported slightly increased symptoms, which is not totally uncommon. So she had more joint pain. She felt more spacey, and she was a bit irritable. It was difficult to stay in touch with this person because of the distance. So I was, depending on email updates from her. So a few weeks went by, and after not hearing from her for actually 3 weeks, she suddenly reached out to report that she was in full Lyme remission. So she had done nothing differently during that period of time, other than she had gone to a chiropractor. She had regular chiropractor sessions, and her chiropractor kept reporting improvements until, after 3 full weeks, all symptoms subsided. It's hard to explain, but there's no other explanation. Nothing in her life changed. She didn't change her diet. She had already been off a treatment, so treatment didn't do it. She's happily reported to me tearfully that she was returning to her job after a 19-month leave of absence. So patient number 2, also female Caucasian. She's 36 years old. She tested positive for Lyme 5 years prior and had tried antibiotics and herbal treatments to help her condition. Prior to the illness, she was a health coach, registered psychotherapist, a Reiki practitioner, and her major symptoms were severe knee pain, kidney and bladder infections, depression, fatigue, and mental fogginess. And she had actually read my book. So again, she was across the country. She reached out to me. She had a strong urge to have an energy session after reading my book. So like with the other patient, we did the session over the phone. She really felt, we did a few sessions. So after the first remote session, she slept for 3 hours and directly afterwards. So she awoke, she meditated for an hour, but suddenly experienced a strong stomach ache and slept for 4 more hours. So after the initial session, we did more sessions, and I noticed that her energy, during one of the scans, I noticed that her energy just disappeared below her right knee. So the way I view somebody's energy bodies, I see it like a holographic image, kind of like a ghostly image, where I can see the outline of the person's body and kind of a whitish, bluish glow. Below her right knee, I didn't see anything. I mentioned this to her, and she said that a doctor had reported to her in high school that she had what she called a dead knee, avascular necrosis. As we began talking, I started seeing what was like a dreamlike scene of her as a man in some sort of a battle in the 1700s with her getting her leg blown off by a cannonball. I mentioned this to her. She felt sensations in that area suddenly, and we continued doing sessions. So ultimately, we did 4 sessions, and about a week after the 4th session, she reported full Lyme remission, and her knee had been repaired. She had a healthy knee, and so these sessions took place over the course of about 2 months, and then 3 months later, to my surprise, the patient actually asked to be trained by me in this form of remote energy healing, and she's become a very effective healer herself to this day, fully healed from Lyme and from the avascular necrosis. Pretty amazing. Here is an interesting story of a bit of a mixed bag of success and failure. This is a patient who came to my office a couple of years ago, a 72-year-old Caucasian male. Strange thing is his wife had seen an ad about me in a local magazine, and she looked me up and started watching an interview with me. And during the interview, she felt a sensation go up her arm, like energy going up her arm, and it went up and hit her temple, and it actually knocked her out. So she passed out watching the interview. And when she woke up, I was talking about, she'd been out for a minute or so. She actually reported to me she had difficulty telling me this because she explained she was not the type of person to even believe in this kind of experience. So that got my attention right away as she reached out to me. And usually how these things work out, she's reaching out on behalf of her husband, the husband who had Lyme for over a decade. And they had tried everything from SOT treatment, antibiotics, multiple herbals, all kinds of different things, magnetic therapy, etc. And his major symptoms were early onset dementia, shoulder pain, traveling pain, and periodic Bartonella skin eruptions. And during symptom flares or herxes, areas where there had been prior injuries, so he had broken arm, appendix scar, and broken finger. These areas ached whenever he had a Lyme flare-up. So we began doing energy sessions, ionic foot baths, castor oil packs, all number of different therapies. I helped them with some herbal treatments from the Cowden protocol and Cellcore. And then we started doing weekly Reiki sessions. Then this is basically what would happen. He would come in for the sessions, and his energy levels and his mental acuity would improve for about 48 hours, after the session, and then he would need to come back in and kind of get, recharged. It was a frustrating scenario where it was just so up and down, and he wasn't just being treated by me. He had been treated by all the major doctors in the Connecticut area, and just the needle wasn't moving so much on his Lyme situation. However, the winter of the first year of treatment, he had fallen on the ice and sprained his wrist. So he and his wife came in. His wrist was very discolored. I've had sprains before. The purple and green skin discoloration. Something that the hematomas. That's guaranteed. At least 4 weeks of recovery. Not using the wrist and keeping it even in a sling. It was so painful for him when I touched his sleeve. It was too much for him. So I did a session with him, a regular session like we'd been doing in the past, moved all around. And by the way, one of the things that I use in my sessions are weighted tuning forks that actually go down to the muscle and bone area. So I had to be careful, where I place those tuning forks. We did the session. I didn't think anything of it. It was on a Friday. They were away on the weekend. Like, the wife asked me if I thought that he needed to go to the ER. And I said, no, just buy a sling at CVS and have him not move it and come in Monday. Let's see how he is doing. They came in Monday, and to my shock and surprise, the wrist was completely healed. No discoloration at all. During the session, when he rolled over, because as I do a session, the patient starts lying face up, and then we're on a massage table. They turn over, and he turned over, putting full weight on his wrist. So the point of this case study is to show that while the needle barely moved on the Lyme treatment, we had a more or less a miraculous healing on a sprained wrist, which is hard to explain. We were all scratching our heads over that one. All right, case study number 4. This is one showing the power of mindset and how that can interfere with treatment. Here's a 28-year-old Caucasian male. Patient tested positive for Lyme disease 3 years prior and had success going into initial remission using MMS, also known as chlorine dioxide treatment, plus some herbal treatments from a doctor in Canada. However, after experiencing a set of emotional setbacks, a divorce, loss of his job, loss of custody of his child, he was having full Lyme flares with suicidal thinking. His symptoms were severe neurological impairment, vision problems, deep depression, and suicidal thoughts. I attempted to help the patient with a modified version of the Cowden protocol, even consulting with Dr. Cowden himself when the bulk of the herbals had no effect on the patient. So the unbelievable thing I'd never seen before was the patient basically said he didn't think he could heal. He was suicidal. He would contact me for emergency sessions, and sometimes I couldn't. I was in the middle of another session, and he would threaten suicide. He was a hysterical patient, basically, in fight or flight 24/7. And treatments that, like from the Cowden protocol that I've seen have effects on any Lyme patient, like on hundreds of them, had absolutely no effect on it. I've never seen anything like it. And the same thing happened with the 2 Reiki sessions I performed via Zoom. They just seemed to have no effect at all. So the patient's mindset was one of, I don't deserve to heal, and I don't think I can. And he spoke those words daily. He reached out to me in emotional crisis all the time. I had to actually stop helping him as a patient. It was upsetting. This case stands out as a reminder of the power of what some people are calling the nocebo effect, which is the opposite of the placebo effect that we've all, we're all aware of, that, when a patient is given a sugar pill or something innocuous that's not supposed to have any effect, and they're told that it will have an effect, and it does. The opposite is true, where this patient is given a treatment that has affected thousands of patients, and he doesn't think it'll work, and it didn't. So the Reiki session also seemed to have no discernible impact on him. So I don't want to leave it at that. That's kind of a downer case study. I want to tell you about one that was an amazing one. So a 50-year-old Caucasian female came to a healing center where I was doing a residency several years ago. This patient came in after I'd given a presentation about Lyme disease and energy healing and so forth. So we started doing in-person sessions. Patient tested positive for Lyme 10 years prior and had tried antibiotics and herbal treatments to help her condition for most of the decade. Prior to her illness, she had owned a business and had to sell it because of her own dwindling functionality. And she complained about losing her identity and who she was. She experienced shoulder pain, but most of her Lyme symptoms were neurological. In other words, brain fog, disassociation, depression. And she brought in a 1-inch stack of all of her treatment history from all of her doctors. And I just looked at it. I held it. I looked her in the eye. I said, I believe you. I believe you're sick. So during the first 2 in-person sessions, the other thing that I didn't mention that's not Lyme related, but she had a rotator cuff tear. So we started off by doing just general Reiki session using tuning forks to help her with her right arm, which she had limited range of motion because of the rotator cuff tear. She was also seeing a chiropractor on the side. And after the first 2 sessions, the chiropractor reported that she was seeing better range of motion and asked her what she was doing. So just to note, at that time, she had already, the pain was so much and she had it for so long in the rotator area that she had already scheduled surgery. So for our 3rd in-person session, we couldn't connect in person, so we scheduled a remote session, which I thought was, a consolation. I didn't think it would be as effective, but now I've come to know that the remote sessions can be sometimes more effective because the body's not there to distract. So a few minutes into this remote session that we started by phone, I received something it's hard to comprehend. I started to see her, but literally wearing a powdered wig and living possibly in France or something 400 years prior. I started to see scenes from her life, and I saw her being pushed down a flight of stairs by a man. I saw that it had broken her shoulder, and I equated this to, this is a past life injury or trauma. And as we, depending on how, what your belief system is about reincarnation, but I've just seen it. I'm just reporting what my experience is with this. If a patient is injured in another life, they carry with them that injury, or at least that weakness in their energy field, into this lifetime. That's exactly what happened. So I was just talking about that with her. And, the patient is a Catholic, so I didn't think she even believed in reincarnation, but she reported, as I was telling her this, and she was open-minded, that her shoulder started to heat up. And I said, that's actually a good sign. This is a sign that you're getting some healing. So she wasn't worried about it. She felt, it was an actual cause and effect situation where, I saw her, reported what I saw her fall down a flight of stairs, and her shoulder started heating up. So we went through the rest of the session, did a regular clearing over the phone, seemed to be fine. So the next week we scheduled another in-person session. And when she came in for that session, her whole demeanor, the way she looked was completely different than what I'd seen 2 weeks prior. She looked completely healthy. She was just bouncing off the walls. She had a skip in her step. She came in, and I was sitting with the owner of the wellness center. We started talking to her, and she said, I have the funniest story to tell you. I went into, my surgeon to have a CAT scan to be measured for surgery. They wanted to measure the tear to see the size of the thing that they were going to operate on. And when the doctor came back in the room after the CAT scan, he had a funny look on his face, and he said, what did you do? There's no tear. We don't need to do surgery. There's no You have no problem. So she explained she had done energy healing. Of course, the doctor was baffled, but as she finished that story up, she leaned into me and said, and by the way, Greg, I don't have Lyme disease anymore. All of my Lyme symptoms went away. So she received, more or less a miraculous full clearing. That's hard to explain. But it was a cause and effect of absolutely from the session that we had. And she's still in remission today and has not needed rotator cuff surgery. So I just want to thank you again, thanking Dr. Mariah Hinchy and everybody at the Lyme Bites Symposium. If you're interested in making an appointment with me for a health consult or an energy session, you can reach out to me at lymerecoveryclinic.com. Click on the appointment request link. You can email me at greg.kirk@gmail.com. Of course, my name's spelled with 2 G's at the end. You can also reach out if you're a practitioner and you have Lyme patients who needs help staying on treatment. We offer discounts for the Cowden protocol and the CellCore protocol. So go to ticktofffoundation.org. And if you're interested in this crazy work I do with Reiki healing and so forth, I run a podcast with a past life regressionist named Wendy Rose Williams. We do a monthly podcast at wakingupspiritually.com. So once again, thank you all. Enjoy the rest of your symposium and good healing.